Hello and welcome back to the channel. I'm Alexis and today is the next installment of Ask a Trans Woman, my regular series, let's just call it that, on trans topics from a trans woman's perspective. Today we are going to talk all about HRT, or Hormone Replacement Therapy. We're only going to discuss this from a trans femme perspective as I have no experience from a trans masc perspective. I'm not going to pretend I know what's going on there, so we're just not going to talk about it. So, with that in mind, Lindsay, what's our first question?
What makes up HRT?
So, HRT, hormone replacement therapy, what is it? What makes it up? Depends on your doctor. And because before you even start HRT, typically what will happen, provided you're going through a medical professional, typically what will happen is you will get your hormone levels checked because that's going to guide the dosage. So depending on your testosterone level, whether or not you need a testosterone suppressant, in almost every case you will, at least initially. The question is, will you just be taking something like spirolactinone, or commonly just referred to as Spiro, or will something else be added to the mix? Particularly if you're having hair loss issues, something like finasteride or minoxidil, those two hair loss medications can also aid with your reducing or blocking your testosterone. Because you may not know, hair loss and testosterone are directly linked. It's also why, one of the few things I do know about trans masc transition from a medical perspective, is you can lose hair, hence the whole male pattern baldness thing. That's directly tied to testosterone. So the lower your testosterone, the more likely you are to have hair growth back. That's why finasteride especially. I personally took finasteride for about 3 months before I actually started transitioning, and had nothing to do with transition, and I was already starting to see hair regrowth, but as a result, my T level was way lower when I actually started my HRT. The star of HRT, though, for trans femmes, is estradiol, or estrogen. It's synthetic estrogen. There are a few different forms of it, but even from a chemical perspective. We're not going to go that in depth here, just because I'm not a chemist, but and we'll talk about the different ways you can take it later. But the main thing here is your two kind of combos are estrogen and Spiro, or estrogen, Spiro, and some other hair loss medication. That is the most common ways that you'll see HRT performed. Later, we'll introduce a drug called progesterone, but that's a separate topic.
What's the difference between pills, patches, and injections?
All right, so like I said, there's different ways to take estrogen. So what are the differences between the different methods? In most cases, though not always, your doctor will start you on pills. Pills are the easiest to obtain. It's also the easiest to take. But some people struggle with pills and aren't comfortable, so you don't have to start with pills. And there are also two different ways that you can start with pills. One is just the standard, a tablet that you swallow, and that's it. And there are pills that they're sublingual. You actually put them underneath your tongue and they dissolve. That is, from what my understanding is that it's actually becoming less common, but that could just be my local area and the availability of the medication. So I'm not sure. Outside of that, your other two main places two main methods are patches, which is literally just like, you may be aware of like a nicotine patch. It's the same concept. You just plop a patch on, in a particular place. I don't use them, so I don't know exactly, maybe it's an arm, maybe it's somewhere else on your body, but you put a patch on, and after a certain number of days, you take it off and you put on a new one. And then it's absorbed into your body through your skin. The probably most well-known outside of pills, though, is the injections. It's like a fairly decent sized needle. I think it's about this big. And you get a vial of your estrogen, And then you take it, I believe it's once a week. I'm not on injection, so I don't know, but I see it all over the internet. You know, basically it's you jab yourself, and I think it's typically people do it in the leg, maybe sometimes backside, but you give yourself a weekly injection, and that's how you get your medication. And it just kind of absorbs and gets used up over the course of that week, and then you do it again. You I believe, want to do it at the same time of day each week, that sort of thing, you know. But again, I'm not on them. There is a fourth method, but it is still considered experimental, so it is not readily offered, and I believe it is in almost every case not covered by insurance, so your mileage may vary on this. There is what's called pellet therapy, and it is kind of weird sounding, but they actually inject a pellet, like a small little pellet, into, I believe it's your butt cheek, and it lasts, if I'm understanding what I've read correctly, it lasts about 6 months, and then you have to get another one. But again, it is still very much considered experimental, so whether or not you even have access to it will depend entirely on your doctor, your insurance company, all sorts of fun stuff. And obviously, if you're trying to DIY your HRT, that's not going to be an option for you.
Speaking of all of those methods, which one has the best results?
Well, isn't that the $10 million question? Now, this is the most opinionated of all of these questions, I think, except for maybe progesterone. But the method you take for your HRT, whether that is pills, whether that's oral or sublingual, injections, patches, it does not matter as long as your numbers are good. Let me say that again. The method you use is irrelevant as long as the estrogen is getting to the places it needs to go and is being used up by your body. Just because you're on pills instead of injections does not mean you'll see, worse results. I am a perfect example of that. I've never had an injection. I've never done the patches. I've always had the same pill, same manufacturer, everything. I've always taken them. I'm very happy with my results. It all depends on your body. There's a lot of chemistry that goes into this as well, because it has to do with both your estrogen level and your testosterone level and the balance between the two, along with something called sex hormone binding globulin. Again, I am not a chemist, I am not a biochemist, but my doctors have explained this to me. That in particular thing is the sex hormone binding globulin is basically what allows the sex hormone, meaning estrogen, testosterone, to kind of latch onto something and then get moved properly throughout the body. So depending on how much the estrogen and testosterone are fighting each other, and then when you introduce progesterone, it gets even more complicated. When you're dealing with all of that, that's what really dictates your numbers. And so, like, the way your body produces it and how you're having to deal with that, it makes a huge difference. Another perfect example of, like, patches, pills, injections, for me, if you are a regular watcher of this channel, and why aren't you? Make sure you like and subscribe. You may know that I have had an orchiectomy already. It's been over a year now since I've had my downstairs bits, not the big one, but the minor bottom surgery, let's call it that, since I've had my testicles removed, which means I have basically no testosterone in my body outside of the standard adrenal gland stuff. That means I don't have to take a testosterone blocker anymore, so I don't have to worry as much about the sex hormone binding globulin, and as a result, I've seen a lot of growth since my orchi. And because it was, the estrogen's not fighting anymore. So that might be another reason why you might want to consider one, but of course, obviously talk to your doctor. I am not a doctor. That should be really obvious, but just in case, this is not definitive medical advice. Please seek out a medical professional.
I have a question.
You do?
Usually I
bonus
wait
round
until the end.
We are getting
of the
bonus
video.
round early. Great. Now I have to make a new slide.
No, but speaking of all the 3 different methods, and you said that, it doesn't really matter which way you take it as long as it works for you and your doctor.
Correct.
Okay, so, but would you also say that maybe some of those methods are more for convenience of the patient?
Absolutely. Earlier I was talking about the needle, which, is about that big from the pictures I've seen. No. That's a no for me. I'm a diabetic. I've talked about this in the past. I do have to give myself an insulin injection every day. The difference is the needle is about this big, and it's very, very thin. The needle for estradiol is a little bit thicker. It goes in my squishy bits, like in my stomach or like on my side, and so I barely feel it. Whereas the estradiol needle, in most cases I've seen people, they jab themselves in the leg, and it has to go into the muscle. And so, ow. That's a hard no for me. So, I also know, like, I have some friends online and some of you, I know you watch, they were on pills, and they switched to patches because it was more convenient, or because of the absorption method, change because of some medical complications, and they found great results with it. So sometimes it's just the way your body works, the way it takes in things, the way it processes things. It could also have to do with your diet, because like other medications, it'll say like don't take with this type of food, because the ultimately chemicals that are in the food, the way everything gets broken down, it affects the medication. So that can happen with HRT too. So you have to make sure, you're taking them at the right time, because when you take your pills matters too. That's not a question that we have on the list. I know, because I wrote the list up. But it does matter. One of my past medical providers likened it to gassing up your car and turning on the engine, but then letting it run overnight while it sat in the driveway. So if you take your estradiol at night instead of during the day when your body's active, it's not going to move through things faster. So that affects things too.
Here's the $1 million question.
The other $1 million question.
Yes. When will you see results? Are you going to take this magic pill and then wake up and have boobs?
Okay, so here's a lot of people make this joke. A lot of people say this and don't think it's a joke. It's day 2 of HRT. Where are my boobs? Doesn't work like that. I think it took me 2-3 months to even physically feel different results. Like, in the sense that, like, I felt a little tightness in my chest because things were starting to very slowly form, that sort of thing. Where I did see almost immediate results was how I just felt. Like, it's almost like an ethereal thing, but it's like, how sometimes you just kind of feel like crap. Like, I just felt better because the hormones running through my body were the ones that my brain was looking for, as opposed to the other way around. Now, I'm not going to get into all the like feel versus biology stuff, but to me, and I know pretty much every other trans person I've talked to, both trans femme, trans masc, having the correct hormones made a world of difference for their mental state, because it's just something about the way our bodies are built that we need the hormone that we don't naturally produce. So it should say a lot about the biology of everything. That's all I'm going to say. But long story short, be patient. Transition is a marathon, not a sprint. You don't just wake up one day and suddenly, your waist has been pulled in, you have hips, your butt's a little bit more round, and you've got a nice chest and everything. You don't instantly become curvy. God, I wish we did. It'd be great, wouldn't it? It's just, it doesn't work like that. Your body is going to basically go through second puberty. And if you remember how awkward puberty was, it takes a while. I have 2 teenage daughters. They're both 12 years old. I've been watching one go through puberty for a few years. The other started just recently. The changes take time. Like a long time. So understand that just because you've already gone through it once doesn't mean you get to like speed run it. There are ways to speed run it that involve a lot of surgery. I don't recommend them personally, but that's your decision. And we'll kind of get into a little bit of that in just a second. But you have to be willing to be patient.
So when should a person start HRT?
So there we go. Like I said, the reason you have to understand that it's going to be a process is you need to start when you understand that. At the end of the day, the time to start HRT is when you feel you are ready. Never let anyone pressure you into starting HRT, because the effects of HRT are largely reversible. It's a whole different debate about, should kids get it and that sort of thing, and for the most part they actually don't. It's more complicated than that, but that's not what we're here to talk about. The point is, you can start on small doses and just kind of get used to it with your body, but you're not going to see a lot of major physical results, but you'll maybe start feeling the mental. That might be a nice way to ease your way into it and decide, like, is medical transition right for you? It might not be. Maybe it takes a little while to get your dosages figured out, your method figured out. That's going to take time too. And so understand that it's a process. And so be prepared, and when you're sure you're ready, that's when you take that step forward.
Okay, so if someone's decided that they're ready to start.
Okay.
How do they start?
Depends on where you live. So how do you start HRT? It depends on where you live. Starting HRT is a complicated process from a legal perspective now. The political climate has changed a lot over the last year or so, especially here in Florida. Some of it is, it's based on your age. Like you have to be 18 in some states, which is its own problem. But outside of that, it requires a whole mess of, you may need to go to therapy first. You may actually have to live as a woman without the medical transition in some cases. You'll commonly hear that referred to as gatekeeping. It's really shitty. It sucks. In Florida, we actually don't have that. We do have basically what's called informed consent, where you're just, if you essentially, you know what you're doing, you're going to sign this paper. Like I think in Florida, for people that are new to HRT, they do have to sign all this paperwork now. The different parts of these laws are also being fought in court, so I'm not sure what's actually being enforced right now. Thankfully, right now I don't have to go through it, because I've been on it for pushing 3 years now, over 2.5 years. But the main thing is you have to look at your local statutes. It could be slightly different depending on the city you live in, but most likely not. But, what state you live in, if you're in the U.S., countries are different, because, like, I know in England or in all of the UK, you have to go to a specific clinic, and it's like a freaking nightmare to get an appointment. And even once you get an appointment, it's like 2 years off the distance. It's a whole thing. So, like, factor that into the when should I start as well. Where you live matters as far as this is concerned. So, you have to kind of look into your local laws. There's a great resource online called Folx, Folx. They are an HRT provider, but whether or not they're able to serve you depends on where you live. So, like, here in Florida, early when the anti-trans laws started, we weren't able to use Folx because they hadn't ironed out their changes. Now, because one of the things Florida requires to start HRT or even to continue it is an in-person appointment. You can't have your first appointment be virtual, which is kind of how Folx works. It's like, you talk to a doctor over like telemedicine, and that was made illegal in Florida specifically for the purposes of HRT. So we have to go through this whole extra process. Thankfully, folks will actually set up your appointment for you based on where you live. So that's a really nice thing, and so that may differ state to state. So keep that in mind as well.
Okay, here's the other $1 million question.
Here we go. This is the one.
All trans women
Just about
debate over.
I think just about every trans woman I've spoken to has an opinion on this.
Yeah, they do. When should you start progesterone?
When should you start progesterone? So I don't take it. I used to, but I don't. So that should kind of give you a hint as to where this is going for me. The when should be dictated by your levels, as well as how long you've been on HRT. I know a lot of people don't want to hear that, and it's a thing that's probably going to blow up my comment section, and that's fine. Just know that this is the stuff that's been backed by both people that specialize in trans medicine, as well as people that don't, like just a regular gynecologist, because my co-host here, who's not on camera, Lindsay, is currently taking progesterone.
I am.
So even her doctor was like, well, here's what it actually does.
So what does it not do? Maybe you should explain that.
And it's interesting because Lindsay and I have had very different effects of progesterone. There's a reason I'm not on it anymore, but she is. The most common understanding or belief, I hesitate to call it a myth because it does work for some people. The idea is that, well, you take progesterone because you want to get bigger boobs. That's not really what it does.
No.
Progesterone is actually the hormone that kind of mimics pregnancy. So really, you only want to take it in cycles, like approximately 9-month cycles. And so one of the things that happens during pregnancy is your breasts do get bigger, but it's kind of a temporary thing. And it's not so much that they overall develop a lot of breast tissue, but it kind of rounds them out a little bit more. And without getting a little too in the weeds here, we've definitely noticed that with Lindsay. For me, didn't happen. Basically nothing happened. I took it for about 6 months and had... The only thing that progesterone did for me is it made me sleepy. And that was nice. I slept a lot better when I was on progesterone than I ever have before or since. So I might actually start taking progesterone again, specifically for that benefit. The problem is, progesterone has some other side effects. How do I put this delicately? It's basically the kind of hormone that makes your body think, put a baby in me. So you get a little horny. Yeah, it's different. And it's different for everyone. That's the other really thing, because all of this stuff, it's all different for everyone. Your body will not react the same way mine did, the same way Lindsay's did, the same way each and every one of my trans friends' bodies reacted to progesterone. That's why not everybody takes it. It just depends. I'm not saying don't do it, but just understand it may not work for you. It may not have the effects that you want it to, but it may have effects you don't want. Yeah, it can get really awkward, and it can make you physically uncomfortable because you sweat a little bit more. Like most people, you stop sweating, but like for me, I sweat a lot more when I was on progesterone than I did when I wasn't. So it really depends. Progesterone chemically is also much more similar to testosterone. So there's when you still have a lot of testosterone in your body, like that whole sex hormone binding globulin thing, that gets more complicated because then you've got the progesterone also competing with the estrogen and the testosterone. It becomes a whole issue. So again, your mileage is going to vary based on your body chemistry. So as much as there are some people that swear by it, that it's the magic bullet. There are multiple forms of progesterone. Did you know that? So most people are used to like the little football shaped, like kind of squishy capsule.
My pills don't look like that.
Yeah, Lindsay's is just like a small little pink tablet. So the type that you get actually depends on your blood work and some body chemistry as well, because there are some inherent risks. Like there are, I think it's like blood clots and which could potentially lead to stroke. That specifically for AMAB individuals is higher. So, and depending on your medical history, that can also be an impact. So keep that in mind. There's a lot that goes into this. It's HRT is not this like, oh, I just need, 6 milligrams of estrogen, 50 milligrams of Sparo, and 100 milligrams of progesterone, and I'm good. It doesn't work like that. Every single person's individual dosage is going to be different on a variety of factors, and it's going to change. It's going to go up and it's going to go down over time. So, like, again, for me, I don't need any T blockers because I don't have any T anymore in a lot of different ways. So, I don't have to take it, which means no worrying about side effects anymore. That's awesome. But at the same time, I then change, kind of tweak my E dosage, stopped taking progesterone. So, it's a lot of different ways to go about it. HRT is not a one-size-fits-all solution. It never has been and it never will be. So that's all the questions we have. Haven't decided on the next topic yet, so if you'd like to suggest one in the comments below, please do so. It helps our engagement. If you have just any individual questions, drop them in there. We're tweaking the format of Ask a Trans Woman again in that, we might switch to short form. So, more questions answered in a faster turnaround time. So we'll see how that goes too. So drop those comments in the questions. Of course, like, subscribe, all that fun YouTube stuff. We really appreciate it. It helps us grow. Until next time, have courage, my friends. And be kind. Especially to yourself.
Did I brush you off?